Neurofeedback is not a magic bullet in any way, shape, or form. We don't want to lie to people about treatment that they could potentially have. Just because you regulate the brain doesn't necessarily mean that the reward for that particular behavior goes away. I don't necessarily think there can be the existence of mental health issues without a level of stress. I think that a lot of the stress that many people incur that manifest these mental health symptoms is probably just issues of modern society.
Welcome back to the Real Brain Talk podcast. Dr. Guy, Dr. Ken, owners of BrainCore Neurofeedback. We have a special guest today. Finally, a guy, huh, Guy?
Yeah,
That's
I know.
Nice, right? We've been
had
all
five
women.
podcasts, all women.
Yeah, so let's welcome
I
Gil.
went to social work school, so I'm used to it.
Let's welcome Gil Garza, one of our BrainCore providers. Welcome to the podcast, Gil. How's it going?
Hey, thanks, guys. It's
Hey,
a
Gil.
pleasure to be here. Pleasure to see you guys again.
Yeah, happy to have you. So tell us, or tell the listener a little bit about yourself, where you're at, and what
Sure.
you do.
Yeah, absolutely. So my name's Gil Garza, as they mentioned. I am a BrainCore provider, so neurofeedback provider in Central Texas. I'm located just north of Austin in Round Rock. I don't know if you guys are familiar with that place or not. It's a cool place. Nope. Suggest it to all. And I began my career as a mental health and substance use case manager. And I worked in inpatient settings and outpatient settings before getting my LCDC and becoming a counselor. And then moving on to grad school as a social worker. And now I'm a licensed mental health practitioner. So I often integrate neurofeedback with a lot of my clients in talk therapy. So
do you have a specific clientele that you that are attracted to you, or do you specialize in any one particular area?
There's been kind of like ebbs and flows and seasons when it comes to people coming in. Honestly, the majority of the people that have been coming in have found me for neurofeedback. I would say it's a primary service that I offer. And really talk therapy became the adjunct to that. So in Texas, LCDCs are not really encouraged to practice privately. So everything that I did as an LCDC privately was done in like kind of the family settings. And it was all cash pay. And so when I moved into specializing in neurofeedback, one of the things that I saw happen was that like people were coming to seek me specifically for neurofeedback. And then there was just specific cases that were more relevant for talk therapy and some others that were just adjunct, where they were already seeing a therapist or some other care provider that I was just helping to case manage.
So Gil, quick question. How did you make it a primary service that you offer? I mean, did you do a lot of lectures in the community? How did you drum up the interest?
The interest and support. Yeah, I mean, honestly, but completely by chance. So I can just kind of walk you through it. So I was first introduced to neurofeedback, specifically BrainCore, not on purpose. I was working at a treatment center in which they integrated something that they called the Brain Program. And I didn't work directly with this program, but I worked with clients that went through this particular program and they would talk it up. At the time, I thought it was kind of phooey. As all people should be skeptical of new things, I believe. Mm-hmm. And so I was like, cool. Congratulations. I'm glad that this is working for you, or so to speak. And then that happened a couple times. And then actually fast forward 2 years later, I was at an adolescent dual diagnosis substance abuse conference, and there was another BrainCore provider there. And I was like, well, this is 2 times now that the universe has put this in my face, so maybe I'll reach out and I'll have a call. And that's when I spoke to Russell. So in terms of how this got traction, really it was just that phone call. And then I got a unit, and I knew that the people that were already on my caseload, those substance use clients, that they would utilize it. And so I had 3 people kind of right out the gate. I know you can't see it, but there's a closet to my back right. And that's where I started doing brain scans, because I spoke to a friend, a mentor of mine regarding business. And I was like, should I take out these loans and open up this thing? He was like, if you can't do it in your house, it's not worth doing. So I was like, okay, I'll do it out of my house. So I started with my first clients in that closet, scanning brains of friends, family, all that sort of stuff, until I got enough money to get like a small counseling office. And then I did that. And then I went full time with it once I started getting my first clients. But honestly, the minute I got that counseling office and I like put it on Google, and I got like the friends that I scanned their brains and the family members I scanned their brains and those original clients to like write Google reviews, people just started finding me. So, wow. I mean, I have done, now I do marketing. Now I do all sorts of marketing and stuff. But the way things got started, it was completely natural. I think there's most of natural need.
Most of your neurofeedback clients come into the office, or do you do a lot of home training? How do you manage the caseloads?
So I manage it in two ways, primarily through the hiring of a technician. That was one of the easiest ways to kind of scale, was to, help and walk through the basics, someone that was capable of being able to pick up on this sort of stuff outside of like a licensed clinician. And then we, on average, probably have 2 to 3 take-home units out at any given time. But the majority of our clients come in. So we have like an active caseload right now. I would say, I think it's 11 or 12 people that come in 2 to 3 times a week in the office. And then we have 1 unit out just at this particular moment. So,
and do you do the technician does all the hands-on stuff? Do you just do interaction, or you do report of findings? And
yeah, exactly. I'll do, so she does, she does the follow through, as well as she started to do brain scans independently, getting clear maps. But I still do consultation calls, report of findings, and then I also offer case management sessions. This is one of the benefits that I've, integrated into active neurofeedback clients programs, is that, a lot of times if they only, for instance, right, like I work in the morning, 7:30 to typically I'll either take a break at 1:30 or 3:30, maybe or maybe not come back in the afternoon. So there's some clients that come in only in the afternoon and primarily see my technician, but I don't want them to not think that I'm involved. And so one of the things that we offer is a case management session, just meaning that every 5 neurofeedback sessions an individual has, they are privy to an hour-long case management, either phone call or meeting with me to discuss progress and updates. So
that's a novel idea. That's a great idea. Great. I like that.
Yeah. And most of the time what I've noticed is that it's very self-regulating, because, you have all these people and there's all these different variables and you want to stay track of all these variables, and it can be kind of consuming if you're not doing it in some sort of direction. But when you empower the client to make that appointment in order to discuss those issues, I've found that you spend less time spinning your wheels in different directions for every given client. And basically, and this is kind of the primary drive of therapy anyway, but what you put into it, you get out of it, right? Exactly. So if I offer this and you take advantage of it, the chance that you're going to get more out of it is likely.
So, Gil, I'm really curious to know what is the main type of client that comes into your office, and what is it about neurofeedback that draws them to your office?
Yeah, absolutely. So as I mentioned, when starting, it was primarily substance use clients or individuals in early recovery navigating that big hump that we call post-acute withdrawal syndrome. And then quickly, as people started to find me, I started to encounter a much larger variety of clients. And I would say now, in terms of clientele, like 50% of my clients are probably under the age of 11 and are coming and seeking me for improvements in mental health symptoms related to spectrum or ADHD or both. And so that's 50% of my clients. The other 50% are going to be adults, and 50% of those adults are going to be somewhere in the spectrum of chronic anxiety and PTSD. And then the other are going to be individuals looking to step down or manage issues related to ADHD or step down from medication with other, in other areas. And that could be anxiety or what have you. So right now it's about 50% adults and 50% kids. And the adults, I would say primarily their focus is stepping down in medication. So your next question was like, what about neurofeedback is so appealing? I would say that for adult clients, the primary drive is, we're kind of existing in this weird, like post-pharmaceutical world in that people are on all these medications and they've started to realize that medications are not the final solution to their particular problem. So there's a lot of over medication, and especially as you are on these medications for long periods of time, eventually these side effects tend to show up. And I think that's what motivates adults to come in. And then similarly, I think that same mentality or that same, thought goes into the parents when they're trying to consider mental health care for their kids. And that's why a lot of the kids come in, is that they're dealing with spectrum or the ADHD, and parents are concerned that the recommendation is typically some sort of stimulant, as they have lost sort of faith in that particular approach, that chemical approach.
I'm really interested in the substance abuse population that you're seeing. And I'm curious to know, are they coming to you for you to help them get off whatever substance they're on, or are they coming to you for what you mentioned earlier, post-acute withdrawal syndrome? And can you explain to the audience a little bit about what post-acute withdrawal syndrome is?
Yeah, absolutely. I would say probably a very exciting area of neurofeedback for me right now has been the confronting of developmental trauma. And that's something that's ever present in the populations that I'm working with any sort of substance use, any sort of abuse history. And you might call it complex PTSD, right? So it kind of breaks down into a couple different things. But it all is rooted when it comes to neurofeedback in addressing this sort of complex trauma. When it comes to substance use disorder, primarily when people come to see me, they're in the early stages of recovery. I don't really have experience in trying to get someone sober, so to speak, with neurofeedback. And in fact, I don't have a lot of faith in that particular process. But this idea of PAWS stands for Post-Acute Withdrawal Syndrome, is a very common term that we refer to in addiction medicine. And it's basically the period following someone's acute substance or chronic substance use problems that the brain is against you. It's your enemy. It plants poor thoughts, compulsive thoughts and behaviors, and it's very difficult to separate yourself from those thoughts and compulsions in a way that is productive. And so essentially neurofeedback in, utilizing those mechanisms of plasticity allow the brain to heal or reform itself in a faster, more efficient way when the individual is placed in a safe setting like sober living or wherever they are post-treatment. And I've found that, things like SMR training and alpha-theta training have been super effective at helping individuals separate themselves from that mental dialogue that, always gets them in trouble, so to speak, specifically in that PAWS window. And PAWS is considered, it's loose, but it's somewhere between, 3 months sober and 2 years, depending on the severity of use.
In those cases where you're doing that, in addition to neurofeedback, do you use other therapies in your office that would be helpful in those cases?
Mm-hmm. So previously, I was referring out for things like EMDR and IFS or parts work, and now I am providing those in the office. So I'm now trained in EMDR, and I have a really big support system in that area too. And so the hope is to start to integrate that in the office as well. But previously, absolutely. In fact, anyone that came to me with issues of addiction or complex trauma, there's always a referral to consider. In many ways, neurofeedback is it's a really, really helpful tool, but it is an adjunct tool. An individual needs to be a part of a supportive and healthy environment, and that includes supports and therapies that are, already tailored and evidence-based for those individuals experiencing addiction or substance use problems.
Did I also hear you say earlier that you're getting referrals from other mental health professionals? They're sending their clients to you specifically for the neurofeedback?
Yeah, absolutely. There's actually quite a few fruitful community partners that I have. One is like a really big outpatient mental health clinic. I'm not sure if you're familiar, but the Meadows, Vander Kolk is like a senior fellow there, and he did all that work with neurofeedback for developmental trauma. And he wrote, I would say Body Keeps the Score is probably 15% of my referrals too. So kudos to him. So I work with them because they provide neurofeedback in their office. And basically I've gone and been like, well, individuals that are really benefiting from neurofeedback and interested in continuing, they can come to me. And then I also have another therapist that comes to mind that refers, because she specializes in brain spotting, which she would argue is a far more effective way of intervening with very severe developmental trauma that manifests in dissociative identity disorder. So individuals that are not necessarily good candidates for EMDR, because of the amount of dissociation they're experiencing, we've started to do work with those individuals, and it looks really promising. And that was kind of scary because when I crack open the textbook, there's not really anything there. So, being a little bit more exploratory in terms of the neurofeedback stuff has been cool too.
What is brain spotting?
Brain spotting, well, I can't give you a good definition because I'm not an expert in it, but brain spotting is essentially a behavioral therapy similar to EMDR where you're tracking a ball, but there's different behaviors to unlock and position the brain in different ways to release certain fixed somatic experiences.
I was just wondering, I mean, I've heard a lot about EMDR. I know several of our members, utilize that as well. But I think it's sort of a similar, well, not similar, but there's a shared access point to alpha-theta where you're kind of bypassing the experience and it's going right kind of to underneath, at least into the subconscious and accessing, I guess, past trauma that way. Can you explain the correlation or how they kind of fit together?
Yeah. And it's pretty experimental at this particular point, just because the two therapies haven't been used together for, all that long. But what I have noticed is a couple different things. So, when we're doing alpha-theta, one of the blocks that would come up from keeping alpha to continue to regulate, one of the things that I would notice is that people would have these thoughts, right, of traumatic experiences and basically become afraid of that particular state of mind that alpha-theta is driving them to. EMDR is a way of processing those memories in a healthy way. And in fact, in EMDR, when we do these guided reprocessings, one of the commands is going to be for them to write down any event or traumatic experience that comes into their memory so that we can process it later. And what I've found is that alpha-theta sort of uncovers a lot of those in a very natural way. So it can sort of increase the efficacy or at least the speed of EMDR in terms of like how effective it is over a short period of time. Now, I will say in terms of like processing, I have noticed that alpha-theta following EMDR is more beneficial. So the way that typically looks is like when someone's coming in and alpha-theta is a part of the treatment plan, we'll get them through proportional tones if they need it, and we'll get into alpha-theta, and then they'll start to report these memories, right? And then that is kind of my cue that it's time for EMDR. And then once we start EMDR, we're working on those particular memories, and then we are following it with additional alpha-theta sessions.
So, wow, it's wonderful to hear someone talk about how EMDR and neurofeedback kind of work together with one another, because my experience with people that do EMDR here in Hilton Head is, when you ask them, hey, should we be doing neurofeedback at the same time as the EMDR? They're saying, no, do not do that. And their main reason, which doesn't make a whole lot of sense to me, but their main reason was that they were like, well, then how would we know which one worked? And I was like, well, I think you're looking at it the wrong way. They work together.
issue.
That's a
Right.
common.
Yeah.
That's a common thing. People,
Yeah.
on my treatment plans, I try and make them as comprehensive as possible, and so that's going to include a lot of different things. I'm going to have sleep hygiene. I'm going to have, supplements to talk to your primary care provider about. I'm going to have all sorts of behavioral things to consider. And I've had that question come up. How do I know if it's this or that? And my answer always is, honestly, I don't care.
I think that's the
Honestly,
compassionate.
I couldn't care less.
That's
As
the
long as
compassionate
you
response, right?
as long as you are
Yeah.
feeling better,
Yeah.
I have done my best, and we've made headway.
I think what happens is, I think people get so dogmatically attached to the things that they're doing. We see it in chiropractic all the time, that they want to kind of defend it, like it's got to be defended. And the reality is that they work together. And if your main consideration is the benefit of the patient, then you would do them together.
Absolutely.
And not worry about which one worked.
Yeah.
Right.
I mean, it's a driving challenge in terms of, the medical literature. I went through this training, getting my master's in social work. But, one of the challenges is that, like, we don't want to lie to people about treatment that they could potentially have.
Right.
The idea of, like, this controlled element is not always an ethical one when it comes to severe issues. And the kind of consequences that come with not appropriately addressing mental health symptoms. So, and from my perspective, I'll let the PhDs and the researchers figure that stuff out. I just want my clients to feel better.
Yeah.
That's good.
Get that 100%. Speaking of which, do you have any particular success story that pops out at you? Is there, some case?
I mean,
that
I have,
wow,
I have a couple that kind of come to the top of my mind. There's always positive interactions. And I will say, I'm not trying to, just to put it out there to anyone that's listening, neurofeedback is not a magic bullet in any way, shape, or form. It is much more akin to therapy and personal training than it is to some, magic pill. It takes a significant amount of effort. It takes a significant amount of resources, but it is worth it if you've exhausted certain areas and limitations, like pharmaceuticals or talk therapy, or if you've hit certain blocks. For those individuals willing to do the work, I absolutely see positive results. And so a couple individuals that stand out in terms of positive experiences, I had a child come to me who was on a max dose of Jornay, which is a stimulant medication for children, and you take it in the evenings and you wake up and it's already kind of in your system. He's 11. He's on a max dose of Jornay. He was on a handful of other things, guanfacine. He was on a handful of medications when he came in, and he was experiencing significant cognitive deficits in the sense that he'd been held back for 3 years in school. He was ill coordinated. He couldn't run appropriately. His speech was completely tangential. So you ask him a question, the complete opposite comes out of his mouth, and then he jumps to the next thing and then jumps to the next thing, and very little capability of social empathy, right? He did, just to give people kind of a framework for how long it takes for serious cases like that, I think he did 120 sessions of SMR training. And in that process, he came completely off of his medication, and he's jumped 2 grades in school and now is able to play baseball.
Oh, wow.
Well, that's pretty impressive.
Yeah, so that's a big one. I'm not trying to draw all the attention to anecdotes.
No,
but it's
people have to
substantial.
know, and the listeners need to understand that, what's possible.
Yeah, no,
Yeah.
Absolutely. And it's
Exactly.
certainly possible, especially when you take into consideration the entire clinical picture, right? When you are coordinating care with their other care providers, when you're making sure and double checking things like hygiene and behaviors in the home and supportive environments in that way, right? You can really if the image that I get in my head, so to speak, is, neurofeedback is a lot like it's kind of like the crowbar to enact the change leverage, so to speak. And then your job becomes removing all the obstacles from the boulder, re-regulating everything. And a lot of times, those things,
That's a good one.
yeah, a lot of times those barriers exist in the environment and take a pretty sensitive approach. And I would say that is where a lot of the skill comes in terms of neurofeedback. But in that case, it was, it was really cool. Yeah. But that's not the only one. In fact, I would say, the vast majority of my youth, and it's probably due to the innate plasticity of their brains, but they see incredible change. I mean, incredible change in terms of ability to speak and make friends. Those are kind of the primary things. Another one that has been that I didn't really anticipate such huge change, but children with enuresis or wetting the bed. For some reason, neurofeedback is shutting all that down. So,
that's common.
and that is consistent. I mean, every single case that I've gotten with enuresis, it has been resolved. So,
have you worked with any spectrum disorders?
Mm-hmm. Yeah, absolutely. Yeah, most of the child that I'm talking about currently that experienced this benefit, he was dual diagnosis with ADHD and spectrum.
The client that took, had those amazing changes and, was upwards over 120 sessions. Was there any incremental changes? Like what made the parents see the benefit? Because that's a longer than a normal caseload, of course. That's somebody who really was a challenging case. But what made them say, all right, this is working and I want to stick with it? Was there, metrics that you went through the process?
So there's a couple things for this particular case that I think was really beneficial. The first was that because they were at such a high dose, we're going to obviously step down. And so we did that incrementally. And the minute that we stepped down from medication and he got worse, but then improved, I think that is what sent the encouragement to the parents.
That's a big
it's a huge change. And then the enuresis. So he would wet himself regularly every single night. And she would have to change the sheets every single night. And what she noticed was that fewer and fewer times when she'd wake him up in the morning did the bed smell like urine. And so, those big things will get anyone on board in my experience.
I got to tell you, if I was changing bedding every day and then suddenly I wasn't, I'd send my paycheck over to you.
No, absolutely.
Keep going with the SMR.
Yeah. And like I said, that's not my only experience with that particular case, right? Where, and I want to give in these scenarios, I really want to give kudos to the parents. I come from substance use. And I've come from adolescent and young adult substance use. Many times the parents are not involved in a healthy way. So, there's no replacement for a healthy environment to support cognitive healing. But if you can promote and you can kind of ensure as best as possible that particular scenario, I've found that for children, the results can be pretty outstanding.
Have you had any parents of children where the children are showing such great improvement that the parents are like, I'd like to do that too?
Actually. Very recently, I had another spectrum child, and he has been seeing lots of benefits, primarily around, speech and social anxiety. He's now comfortable and can hold his tolerance levels higher, so he can go out to family events and weddings without having a meltdown, or he can interact.
Huge. What a lifestyle change for the entire family.
Yeah, absolutely. And honestly, that's a primary goal of mine when it comes to the youth, because just in terms of developmental cycles, right, the ability to socialize can resolve so much. Even if you are sort of, different, not neurotypical, just being able to develop relationships has a huge improvement. But I saw a huge improvement with this young child, and then all of a sudden mom wants to be a client. So absolutely, it happens frequently. And in those same cases, I also get referrals, I would say specifically the spectrum community or parents of spectrum kids, that community is very tight knit. It's a very tight-knit community in which they provide a lot of support to each other. It's one of the ways to get that, respite and support, as it's super, super challenging to be a parent of children that are not neurotypical in some situations. And so if you can establish trust and legitimacy within those circles, I found that, the dividends are super high, and you can provide so much more care to other clients as well.
I liked what you said before about the healthy environment is a key for any type of therapy. You have to have that healthy environment. Have you encountered situations where a child comes in is not neurotypical, and you want to work with them, but you also know that they're in a bad environment? The parents don't care, or maybe there's the substance abuse parent or what have you. Have you ever encountered that? And have you ever suggested to the parent, hey, maybe you should be doing neurofeedback too, or something like that?
Yeah, for sure. So in most of the situations that I run into when it comes to parental issues, it's not like negligent and it's not any sort of active abuse that I see. There might be things going on under the surface. The primary issue that I run into are manifestations of disordered attachment. That's the barrier that I run into with some kids, is that.
Can you explain that a little more? Detail?
Absolutely. So disordered attachment, right? Our attachment styles are built from our relationship with our parents when we're very young. When that is pressured in one way or another, there can be maladaptive coping skills that a child does in order to meet their needs. And oftentimes it takes the form of tantrums and irritability relative to that specific parent as a way of trying to force the attention that they feel like they require out of them. So in the case that comes to my mind, there was a child that I was seeing for ADHD, and they were seeing benefits. But one of the things that I noticed was over time there was increased irritability. And this irritability wouldn't necessarily have been relative to the neurofeedback. But what I noticed was that in speaking with the mother is that, she had separated from the father at very young age. And essentially between the ages of 1 and 3, she had a lot of different boyfriends. And the child would describe, these boyfriends as like their friend. And so you develop this relationship with a caregiver, and then he goes. Develop this relationship with a caregiver, then he goes. Right. And then in that moment too, the child is also competing for the attention of his primary caregiver, of the mother. And so and then they see the partner that they're with, that they're choosing to spend time with, not them, leave, and they put themselves on par. So then they get these very reactive attachment styles. And that means that, either mom needs to be super close to him all the time, and, you get very clingy children, or the opposite, you get this avoidant children that are dismissive and unobstructed by, basically demands and different commands of the parent. So I found that is something that obscures the health of, or the longevity of neurofeedback, because there's a behavioral component to it, right? In the sense that, even if the brain is working, if you've entrenched this particular behavior that I'm going to throw a tantrum every time I'm not getting what I want, just because you regulate the brain doesn't necessarily mean that the reward for that particular behavior goes away. Right. So if you're in an environment in which you throw a tantrum and you get what you want as a child, the same thing is going to happen after the brain is still regulated. Now, it might feel a little bit weirder to them because they may not have that internal angst that was previously driving them, but they know on a subconscious level that if I throw a tantrum and if I play chicken with mom, she's going to give in. And, those sort of behavioral reinforcements, I have found to be a hindrance to the efficacy of neurofeedback.
I think that's a great point. I find that all the time. We do mentoring calls with providers all the time. And there are some unrealistic expectations when, looking at somebody of a certain age in a developmental situation with psychosocial stressors, and expecting neurofeedback to make all the changes. There are certain behavioral problems that are behavioral, and they have to be dealt with on that level.
Yeah.
And that's why I always draw the comparison between the brain being the biocomputer in the head and the personality, which is like the software. You know, so we've got the hardware and the software, and the behavior is really coming from the software. And what you said was, even when you remove the hardware dysregulation, right? When we, you know, made that, you know, regulating properly, there's still that behavioral component. That software is kind of rewriting itself into the hardware. So now we have to address it from that side so that we can create a more universal calm.
Yeah. And I mean, honestly, that really brings up kind of where my head has been spinning around neurofeedback. I don't know if this is appropriate channel, but, you know, in terms of like developmental trauma, right? Personality disorders are huge, and personality disorders are basically the entrenchment of utilizing affect, or, you know, the precursor to mood, in order to manipulate or get what you want. So things like borderline personality disorder, on a subconscious level, right? What's happening is they are using extreme behavior in order to meet their needs in a way that were unmet in the past, most likely due to some form of trauma. And how to regulate individuals like that are so volatile in their mood, because from that neurofeedback perspective, right, we're talking, I don't want to say singularly because it is extremely complex, but in terms of our understanding of neurofeedback, it is pretty singular. We work on this area to work on mood. We work on this area to work on anxiety, or to, you know, improve calmness or wakeness or sleep. And so when you have things like personality disorders that culminate all these different symptoms, being able to effectively intervene with that has been kind of where a lot of my focus has been recently.
Yeah, and
are the personality disorders always related to trauma, past trauma, or are there any cases that you're aware of where, you know, someone presents with you know, borderline personality disorder and there just is no trauma in the past?
Well, there's a couple different ways to look at it. You know, from the lens of trauma, you could look at it. I like the idea of little t, big T trauma. Right? Little t trauma being any time your parents or individuals in your childhood were unsupportive, right? They did not encourage or reinforce the appropriate things in you. Big T trauma being things like abuse, neglect, things like that. And then there's also another theory that I like to look out of the lens of a woman named Melody, I believe is her name. And she looks at things, instead of, you know, putting these trauma concepts, she looks at through the concept of codependency and like how you relate to individuals over time. So honestly, I don't have a short answer for you. Maybe not. But right, in my understanding of mental health, it's a unique biological response to a unique environment. So there's a unique individual in a unique environment, and the genes under that particular stress express themselves in the form of mental health symptomology. And so in many ways, I don't necessarily think there can be the existence of mental health issues without a level of stress. Now, whether that stress is trauma is difficult to determine. And in many ways, I think that a lot of the stress that many people incur that manifest these mental health symptoms is probably just issues of modern society, honestly. And pressures of making work and all that sort of stuff.
And what about environmental trauma? Like, it may not be something with the family dynamic or the parents. I mean, we went through quite a traumatic period when COVID hit.
Absolutely.
Right? So somebody's social, you know, and functional, you know, society all of a sudden just stopped.
Yeah.
Right. That could cause somebody to experience that sort of trauma and it unfold that way.
Absolutely. Gabor Mate, he speaks at length on this particular topic as it relates to ADHD. His understanding of many manifestations of inattentive ADHD type, non-hyperactive necessarily, but is essentially a sensitive individual, so unique biology, in a particular environment. Their parents are stressed to form issues of ADHD. And he draws this back to his personal experience of his ADHD diagnosis, but growing up in a perfectly healthy family. But the thing is that when he was a child, it was World War II and they were in Hungary, and mom was constantly worried about the persecution of Jews, as he's Jewish. And so he had no connection to this particular experience. He doesn't have any recollection of being pursued or any, you know, conscious or unconscious memories of fear or anything like that. But what happens is it becomes mimicked, right, from the parent stress. So they see the parent stressed, they're sensitive, they're attempting to re-regulate, and apparently that can be a manifestation of ADHD. So absolutely, environmental
So
stressors can
in
be the
our
cause.
layman's terms, we refer to that as generational
Yeah,
stress, right?
absolutely,
It's
absolutely. What's passed down, and so you can take into consider any array of environmental stressors, but I think we're moving away from that concept, at least that was prevalent 20, 30 years ago, of like, we have these chemical imbalances. Now we do have these chemical imbalances, but the question goes beyond that. Why did our brain see it fit to create these chemical imbalances in our brain? It's a method of adaptation, in my understanding. It's a way of trying to predict future concerns and, effectively navigate those. But the problem is that those adaptations are ill-equipped to deal with, showing up on time and managing regular day stress and advancing yourself in the workplace, things like that.
It's fascinating.
Yeah, that is fascinating. It's like really, really deep stuff. Stuff that I've never thought of.
Yeah. Well, there's so much coming out now, right?
Yeah.
And, bringing it back to neurofeedback, like I said, I think that society is curious and hungry for more answers beyond, some use of some pill as a blanket way of attempting to improve symptoms, and moving away necessarily from a medical model of deficits and moving into like more of a performance model. And that's one of the things I love about neurofeedback is that, whether an individual has ADHD diagnosis or not, it's kind of irrelevant, right? Because what are we working on? We are working on the symptoms associated with ADHD. What is impactful to you, right? What is the challenge for you? Is it the inability to sit still, remember things, put words together? And that more informs how we're going to intervene with neurofeedback than it does, if you have this diagnosis or not.
Yeah, I think that's well said. We try to emphasize that. Although we take that in the history, we definitely don't want to address the diagnosis. We want to address the functional person, right? We want to look at the bio, psycho, and social factors that all combine to help them relearn how to regulate properly.
Absolutely.
It's a great outlook, and I appreciate you sharing that.
Mm-hmm. I was curious at where you guys think neurofeedback's going and what role BrainCore might have to play in sort of this movement that I see with individuals, seeking out neurofeedback as an alternative way of dealing with their mental health symptoms.
Well, I personally think that that neurofeedback in general is going to become more and more accepted in society. I think people are going to start to recognize it as more research comes out, as more of these anecdotal stories come out about how effective it is. I think people are going to start looking at it, more and more mainstream. A lot like, if you think about, I have a background in chiropractic. So for me, when you think about chiropractic and the history of chiropractic, there was a time where chiropractic was at the same kind of stage that neurofeedback's at right now, where, it wasn't really accepted and we were called quacks and whatever. And now you look at it and, every professional football team has a chiropractor, so it's accepted in mainstream now, mainstream healthcare. I think that's the direction neurofeedback will take. There's no reason to think that it wouldn't do that. As far as BrainCore, we want to be at the forefront of that. We're always working really hard to make sure that we're always updating software. We're updating, the protocols. We're updating our approaches based on the newest research. So I think BrainCore is going to be a leader in that evolution of neurofeedback into mainstream health.
Yeah,
that's my opinion. Ken, what do you think?
No, I agree. It's about an evolution. Now, I know a lot of our listeners think that neurofeedback is kind of brand new, but it really isn't. It's been around since the 1960s. Now, technology has improved tremendously, and where it used to be in big university studies is now able to be accessed clinically with a lot, simpler way, and technology has made that incredibly possible. So, as technology unfolds, it's going to filter out through more people. I will say some of the drawbacks are, unlike the medical model or the pharmaceutical model, which is very organized in a way, and they have a very organized message. Anybody can tell this just by popping on their TV and watching for 10 minutes and seeing that almost half of the commercials are about a medication that you don't even know you need until they've told you you need it. And that's a medication that you can't even go buy off the shelf. You have to actually get a diagnosis to get that medication. But, that's how it's so ingrained. Now, we don't have neurofeedback is spread out. It does not have that type of
Focus.
Focus, financial backing, where we can put national television commercials and be on Super Bowls and all that stuff. So it's a different approach that has to be looked at differently. And I just think with practitioners like yourself, reaching the people you do and making the amazing changes you are to your community is what's happening in little places all throughout the world, and certainly throughout the United States. As BrainCore, we have providers all through, all over the place. And having that is just, it's a growth. It's more like seeds that are planting and it's growing. And as it grows, I think it will become a more normalized approach. And it is much like you said, it's an exercise. It's more akin to a training method that you're doing to help yourself, as opposed to a treatment oriented where somebody's doing something to you.
Yeah.
And that's a shift that's slowly, I think, happening more and more in society.
Yeah. And as it evolves and as healthcare philosophy evolves, more and more people are realizing that, your health really is your responsibility. You've got to do the right things. It's no longer, people are over the whole idea of, I'll just take a pill and it'll fix it. We're seeing more and more people say, yeah, I know that the drug may give me some short-term benefit, but the reality is that if I really want to fix this problem, I got to do some work. And neurofeedback is a training modality. It's a learning modality. It requires you to be committed to doing the work that's necessary to fix the problem at its root cause, rather than just masking it with a pill.
Yeah, and the pills come with cost, and I'm not just talking about financial cost. They're not one way. There's some benefits and some cost associated, and I think as the costs start to mount, people are looking for other ways to do it internally instead of having to do it externally.
Absolutely. Yep. Yeah, I've learned quite a bit, kind of in recent years in trying to remove stigma regarding, talk therapy and trying to improve the scientific literature around that stuff. There's a lot coming out about CBT and EMDR now, and they've had to basically advance and change their entire model in order to basically make it fit this medical model that can get the appropriate approval. And by appropriate in quotes, I mean insurance. Appropriate, right? And there's a lot of growth to it, and and in many ways, neurofeedback has kept itself on the sidelines of that. I think by the diversity of its providers, as well as there's still a diversity in school of thought in approaching neurofeedback and how to do it and where to do it. And I think we're also seeing that in like take-home units and things like that, or these at-home devices. But nonetheless, I think all of it speaks to a unmet need. And, anytime there's that much evidence of an unmet need manifesting in all these different little sectors, I'm curious at how it's all going to come together, so to speak, because I have no doubt that it will, and that someone will make that step to bring it all together. I'm just kind of curious at y'all's thought process in terms of how that's going to be done.
I will tell you that, when we talk about the evolution of neurofeedback, 8 years ago, I would have laughed at you if you said, "Hey, we're going to have home training." I would, yeah, right. Yeah. And now it's it's part of the protocol. It's so. Yeah, I think we're going to see things like that happen more and more.
And I can tell you this about BrainCore: we are not going to, with the example you just mentioned, we're not going to move towards, we're not moving backwards. We're not going to move towards that model. We are going to keep, forging ahead and letting people come find this rather than try to move towards, an antiquated concept.
Yeah, for sure.
Well, Gil, it looks like we're pretty much at the end of things here. I want to thank you so much for being on this. It's been amazing and fascinating, and I've learned so much. I'm sure our audience has as well. We would love to have you back sometime, and we're very grateful that you are part of the BrainCore family, and we're so happy you're doing so well there and changing people's lives. Thanks again.
Absolutely. It's been a pleasure, guys. I know we normally talk on phone calls separately, so it's cool to have everybody here together.
Yeah.
And what's the countdown to the symposium? We got 2 months.
Yeah.
You're coming, right?
Yeah, absolutely. We're coming. So that'll be a lot of fun. I'm looking forward to it. But
Really
thanks for having me,
that.
guys. I appreciate it. And I'll be on anytime.
All right. Thanks, buddy. Take care.